Okay, another week. More people are out and about, and we've seen numbers increase. 22 states around the country have seen numbers increase. And we've been talking about this as far as looking around the world and seeing some countries reopen far earlier than us and seeing setbacks, if it's in Italy, if it's in China or other areas that have been wearing masks. So let's start there. Why, and I know that it's still early and we still need data from a lot of the weeks of protesting, but why are we seeing spikes and why are we seeing cases increase since reopening a lot of the country?
Well, very good question. And I think there's a sort of a simple answer to that. You're dealing with a highly infective agent, which is the SARS-CoV-2, right? Which is the virus. It's highly infective, and transmittable. And the more people you're going to put together, the more likely there's going to be transmission. Period. That's it. Now, there are some people who are trying to hide behind the fact that we're doing more tests and therefore we're discovering more people. Well, that may also add to the total numbers, but the fact of the matter is that infections are increasing, as you mentioned, in 22 states, but it's probably more than that. But we could avoid history completely and ignore it. But if you look at the pandemic of 1918, there was a second phase also. Again, people are frustrated because they are locked down, and their livelihood is severely disrupted. So it's not it's not a judgment call in many ways in terms of being judgmental, but we can understand why people are gathering or people are going out to again into situations where there are large crowds, where the likelihood of transmission is increased. So it's not because the virus has changed or because we're managing it. It's really, again, back to human behavior.
How much of, and I know that people point to one thing because we're such a simple society where we need one thing. We need one thing to fix it. We need one thing to blame. We need one thing, and then it's just easy so we can move on. The more complex of an issue it is, the more time that you'll have to spend on it. That's why people like you work on the complex stuff, and people like me deal with people who just want to hear one thing. So masks have become the new tests, which is the politicized portion, if you will, of the virus. But my question to you is, why are countries that have been wearing masks much more prevalent than us way before COVID-19 hit in China, South Korea, Singapore, Japan, seeing second waves and spikes, if in fact so much of what we've been told is just, if you wear a mask, you'll be okay?
So again, first of all, not everyone in those countries wears a mask. That's to start with. And if you look at the reasons that masks were used in Southeast Asia, as an example, it was for pollution. And the pollution particles are clearly much larger than the virus. And again, these masks have a certain half-life, if you will. They become less effective with time. So the wearing of the masks in countries that are inhabitants that are in Southeast Asia has probably some level of protection, but not enough. And as I mentioned, also there are a lot of people there who don't wear masks even before the COVID-19. So, will it be that if we're dealing with an X number of people who get infected, the secondary infection or the second phase, if you want to call it, would it be a larger number if nobody wore masks? I would surmise or suspect that that's probably going to be the case because, again, they do offer some protection, but not foolproof.
So now that things have reopened and we're starting to see cases rise, and you mentioned why and a couple of reasons that would contribute to that, what's the next step? What's the next immediate step for the next 2 to 3 months? And maybe that's too long. So the next 2 months, in your opinion, from a medical standpoint, and understanding that the medical point of view doesn't necessarily always hold up with the economic or especially political point of view. Is it looking at just being extra cautious and going back to where we were where we were back inside? Is there anything we can continue to do by being outside and mitigate with our behavior on top of wearing a mask?
I think that the quick answer is that slowing down the reopening is one solution, meaning that the stages that we have, instead of making them short, making them more prolonged. But that is going to be helpful. But I think that the principle of social distancing and wearing masks and washing hands should never leave until this pandemic is over or gone. Because again, there's no question that the economy being stagnant as it is right now has some healthcare effects also. So we can't ignore that. So I think that everyone is supportive of opening the economy again, but I think that we need to change the way we approach each other and continue to be cautious. To ignore these principles of caution, I think is going to put a huge burden, well, both on healthcare, as we see in Texas and Arizona, but I think also in terms of the economy, because if it continues at this rate in some of those states, they may have to shut down the economy again. And I think a second shutdown will put many people out of business, whereas right now they possibly have an opportunity to survive.
What's happening that we can look at? I know China had a pretty big setback, and now they're saying that their new cluster appears to be extremely severe, is what I saw it quoted as. And we've seen other countries that look like they were doing fine have this setback or even a second wave, if you will. What's happening here, maybe in the backdrop of what you think or see is happening in China?
Yeah, it's very hard to compare because I don't know that we're getting the full picture from China. But even if we are getting the full picture, I think that we can make comparisons in many ways. I really don't think that there's going to be much of a difference for the second stage or second surge of this pandemic. Um, it may be that there are more people crowded in China in the areas where you see that, so that may have a higher number, and possibly with a higher number of infected people, you're going to see a higher number of mortality. But I really don't think that there's much of a difference in terms of this particular disease.
Okay, so on that note, if in fact what we see continues and it's more of a second wave, it's more of a spike because of reopening, a lot of people will point to what data has been out and used throughout, politicians and media alike, and say, well, the 99%, and look at how many people are asymptomatic versus the people who actually, in whatever age group, to a nursing home, were unfortunately the majority of mortalities. Are we looking at that basically happening again, to where the majority of people, if you didn't get it the first time around, are going to be more likely than not asymptomatic? And unfortunately, there's going to be a pocket of the population that is the same. It's just they lucked out the first time and didn't have contact with it. And now you have to be extra precautionary again because we're back to that second wave.
No, I think what you're saying makes complete sense, and that's a very good possibility. What the other thing that compounds your question and statement is the fact that we really don't understand the immunity that gets generated for this virus, and that those who have been infected before, who survived and now are part of the second wave, the big issue, of course, is if they have some immune response that has been generated due to the first infection, does that put them at higher risk of getting a very virulent reaction, in autoimmune reaction or immune reaction with a second infection? We don't know the answer.
So, what is any type of measure that people can take. And I don't even know if we're at a point now where a country, because it doesn't look like even China, who was ahead of this, right, is experiencing a third type because it hasn't been around. But is there a belief that it's a matter of just weathering this second storm? And yes, it could be here yearly like the flu, and a lot of people can get a vaccine moving forward and be okay? Or is this thing expected to just keep hitting with similar waves unless we stay at home for 6 months?
Um, no, I don't think we can afford to stay at home for 6 months.
But if it's going to keep coming back to this extent,
We know, yes. I mean, essentially, what you're saying is, if I may, fortunately
please.
paraphrase it, is the fact that we now have this virus in the population, and it's going to be cyclical to most, as most viruses are. Hopefully, it'll be cyclical. And yes, we are putting a lot of faith in the vaccine, but keep in mind that we have to be very cautious because the vaccines have their range of effectiveness. And in fact, getting a vaccine that actually has a significant effect may be very challenging, especially with envelope viruses. I think I've mentioned before, we have been looking for HIV as a vaccine for HIV for decades and not been successful. I don't want to be pessimistic, but I think we have to be realistic that if this reopens again as a seasonal or non-seasonal infection, that your best protection again, yes, vaccine if it works, but again, social distancing, possibly masks and hand washing are back on the table. Um, you know, there's the hope, and then there's the unknown. So the hope is that this goes away and leaves us and allows us to get back to as normal a life as possible. And then there is, of course, the reality, which is we can't predict and we don't know. And under those circumstances, we need to develop behaviors that are protective. And to throw them out the window because we have, because New York has now the lowest rate of infections from the highest, I think that even if you listen from a political point of view, the governor of New York is still making sure that people change their behavior and remain protective. And I agree with that.
Okay, so that's an interesting point, which is if you look around, and the best site that I found, and I don't know if this is the best one or not, but Johns Hopkins EDU has a coronavirus that site that gives you the individual states and the 7 day average. So you can look at all states' views of week to week changes according to
Right.
the data that comes in. But you raise, I think, the best point about this, which is if you're just taking it in a snapshot and you see Pennsylvania or New York City down significantly while Arizona starting to spike, you don't see the complete story, which is one or two of these states started from an epicenter and is now dealing with it as manageable versus these other states that weren't really dealing with it to the extent of it being a problem and
Right.
now it being a problem. So it's almost separate scenarios happening in the same country.
Right. And you're right. They're a continuum. This is not like a stop go. They're definitely a continuum for these states. The southern states, as you know, have had a large influx of infected individuals from Mexico, U.S. citizens who have gotten infected and crossed the border, and again, probably have some effect on the total population that they're dealing with right now in terms of the rise of the number of people infected in Texas and Arizona and the southern states bordering Mexico. Um, the same thing happened in New York to an extent, which was that everybody was blocking people from China, but no one really thought to block people from Europe, who again brought in a significant impact of this disease to the New York area, the tri-state area. Um, So again, um, I agree with you. I think that this is not a stop go, meaning New York now is in the clear and now Arizona. It definitely is a continuum. And the prevalence of the disease is changing from one area to the next based upon two things. Number one, the initial insult, meaning the number of people coming in infected. And two, I think that the mortality rates, which were high in those areas, have to some extent cleared some of the infected individuals, unfortunately.
Okay, what now should be, you mentioned social distancing and some general practices, but let's look at a scenario or two and kind of get your thoughts on it. As far as traveling, let's say I live in the Midwest and I want to come back and see my family, and there are some elderly people, there are some young people in my family, and I'm taking a flight from Columbus, Ohio to Newark, New Jersey. Am I to quarantine for 14 days before I see these people? Am I okay to just hop off the flight, mask up, keep 6 feet away? What's, in your opinion, the best protocol now?
Well, again, I think that the dictum right now, and it is difficult to argue against that, is that you should quarantine yourself after arriving from an endemic area into another endemic area. The 14 days is a long span. Likelihood is by 10 to 14 days, if you don't have any symptoms, you're probably in the clear. That is the most considerate, clearly is what's recommended. In some states, it's mandatory, but not everybody's following. But that is the most considerate approach that you can have, is by quarantining, quarantining yourself after arriving.
And
Uh,
2 weeks, we're still at that point.
we're still at that point. At the same time, once you're done with quarantine, then again, as you emerge, masks, social distancing, and hand washing are clearly required. So we could try to cut the corners, we could try to find loopholes, we can try to find all sorts of things, but that is the dictum. Now, you sometimes have to make a decision based upon the urgency of your visit, and that has to be done case by case. I can't make any sort of a sweeping, generalized comment on that.
Sure.
But there are situations where you have to make a decision based upon the circumstances you have.
If you are at a job, or if there is something in your life that is requiring you to either be, it can be something as obvious as a medical professional, a doctor, a nurse, somebody working at a hospital, to maybe somebody working at a plant, somebody working at a prison. So those are some of the obvious ones. Maybe there's some more subtle areas in life as well, but I imagine it would be the same scenario, where if you're working in an area or a building or a hospital, fill in the blank, and you're now going to reinsert yourself with family that you're not seeing on everyday basis, do you then also have to quarantine?
Well, you know, it's probably impossible to do that, but as you know, a lot of healthcare providers had emotional stress as a result of coming home from an infected area, potentially infected area, and segregating themselves from the family. Now, there are places where people basically, when we had other epidemics, where people basically segregated themselves until they were washed, changed their clothes, did everything, and then come in contact with their families. I don't think we have one specific formula, but and many individuals make the decision, especially if you have anyone in the family who's at high risk, such as elderly and ill. Whether it's a cancer patient in the family who's on chemotherapy or others, the social distancing and providing some kind of barrier is probably a wise thing to do. You can't start quarantining yourself every day for 14 days
Right.
because basically what you want to do then is to just have some kind of a screen between you and the rest of the family, where you can possibly see them. And you've seen that probably on television. We've seen that before in terms of these scenarios. So we don't have a clear answer, but it really is a situation where it's very stressful, especially if you're working in an area that has a high prevalence of infection, as you mentioned, whether it be a prison, hospital, etc. But those are the consequences of a pandemic. I mean, it's pandemic is a global infection that carries a significant health burden as well as mortality. And if that does not affect our lives, I don't know what will.
I wanted to get your thoughts on something happening with HIPAA and the sports world, but if we can end on this with COVID, moving forward in the next 2-3 weeks, based on where we are right now shooting this video, seeing numbers increase, yes, it's a concern. Yes, we should still be vigilant in our behavior, but the spike is somewhat expected. Does that level out the emotion attached to this, or is it still looked at as we're worse off than we were before we reopened?
So, yeah, I'm not sure I understand the last part of the question. If you
Basically, people apply emotion to this, right? So when we're looking at the reopening and we see numbers rise, that's always going to be associated for people, especially how it's portrayed in media clippings or pieces online, that it's bad, bad, bad. This is terrible. This is terrible. And while nobody wants to see a positive case, when you say that it's inevitable and it's expected based on it happening elsewhere around the world, it's almost softening the blow to where, okay, this is going to happen. Let's weather it, get through it, as opposed to we've done something to directly impact this second wave happening.
Yeah, I think if I understand what you're driving at, I think that there is clearly a tsunami of emotions. There's no question about that. In addition to that, there is a very strong, and I'm sure this is an understatement, a very strong emotional desire to get back to normal activities, whether there be personal jobs or, again, as you mentioned, in the sports and entertainment world. Everyone wants to be able to get back to that. There are going to be consequences as you get crowded, and we know that. So the only way that we can do this in I guess, compassionate way is to continue to protect ourselves and each other from transmission. That's really the only way to do that. And unfortunately, we have a significant number of people who are very visible, who are making it, making this sort of almost a joke, the social distancing, the mask wearing, and the hand washing. It's not, and there is this sense by every human being that they are basically not the one who's going to get it. I'm doing everything I can, but at the same time, I can't believe that I'm going to get this infection. And when you interview people who feel this way, they clearly have a very different opinion of what they should have done prior to that. So again, I think that we're going to see people taking risks. I think we're going to see things open up. Some are going to be done in a very thoughtful way that is protective, despite the fact that there may be consequences, but then there are going to be some places that are not going to adhere to, safety measures that we take, and they're at a higher risk of re-shutting down. And the second, we're concerned about the second wave of the infection, let me say that the second wave of a lockdown is just as bad, if not worse.
All right. So last thing, There was a football player, well, a bunch of players have tested positive for COVID throughout college and the NFL, as this sport is a long ways from returning on the calendar, of course. And one of the players for the Cowboys is now upset that his HIPAA rights were violated. And I figured no better person to talk about this with you, as you deal with this on a day to day basis, as any doctor and medical professional will. There are certain people who are subject to HIPAA. There are certain people, like everybody else, who is not, especially in the backdrop of a professional athlete who signs a contract that allows personal information like a broken hand or surgery or a strain, a muscle tear, something that may prevent me from playing the next week. All of that personal health information is public. So why all of a sudden, if somebody signs a contract that allows that to basically violate the rights, air quotes on that, would it be different with COVID?
Well, it wouldn't. And again, it all depends on what's in the agreement, what's excluded, what's included in the agreement. Uh, the fact that someone signs an agreement that allows their employer to divulge health information, I'm sure there's some ceiling and there's some floor to how much information they can give out. But regardless, since I don't have access to these agreements, um, it doesn't preclude someone becoming upset if the information is made public. Now, the big question, of course, is why, if you agree to the information to be public, at the same time you're going to be upset. My question, I guess, which I hate to answer with a question, is:
Right.
you upset is because you were not cautious, knew that you were positive, and you were not cautious with either members of your club or members of your family, which again, people would turn around and most likely, if they get infected, uh, have cause to think that this was a carelessness on the part of that particular player.
Awesome. I appreciate it. Be well, be safe.
Right. All right.